I've been around the nicotine and tobacco space for many, many years. But one of the areas that has always interested me is the therapeutic benefits. And increasingly, I'm seeing more and more of this research and evidence emerging. I think what's interesting is in next slide, please. But in human studies, acute administration of nicotine can have positive effects on cognitive processes. Just so you know, my slides will be available, and in the notes pages, I've put references and links to all of the scientific papers which back up all of what I'm intending to say. But I think what is interesting, and here I'm talking about people who may not necessarily have smoked, or the nicotine naive, people who find therapeutic benefit in nicotine, who may not be smokers. And that's where I think this whole area needs to be decoupled just from the usual THR area of smoking cessation only. It's moving forward with benefits of nicotine. I mean, we all know that there's carcinogens in tobacco smoke, but nicotine is not among them. Drug companies have refused to fund research into the therapeutic and potential benefits of nicotine due to the stigma of smoking. And really, nicotine can address some of the big societal issues that we have in the world. The big ones: obesity, depression, anxiety, Alzheimer's, dementia, etc. I myself started about 3 years ago. I've never smoked or vaped or used nicotine, and reluctantly, because of all the research I'd read, I started to use nicotine pouches. But what I'm going to say, most of the research has been done on patches or chewing gum. So I think it's really worth it in the THR space looking at these future areas. Next slide, please. I'm going to turn to one of the biggest areas where nicotine is useful, and that's Parkinson's disease. There's a lot of information on the slide there, but what's interesting is that Parkinson's is the fastest growing neurological condition in the world. It's associated with tremors, slowness of movement, rigidity, etc. And what I also found interesting is on the Parkinson's UK website, it actually says that smokers have a 70%, that's 70% reduced risk of developing Parkinson's disease. Now, that's of course not due to the smoke, which is the killer. It's due to the nicotine included in the smoke. But it actually reduces the chance of getting Parkinson's disease reduces if one stops smoking. So I think the THR community has a role, I think, to advise people like Parkinson's UK that they shouldn't be using smoking, they should be using nicotine and other alternatives. One particular study I found interesting was carried out, a very large one, nearly 300,000 or 250,000 across 8 countries, and it found that former smokers were 20% less likely to develop Parkinson's, and that increased to 50% less likely if they had current smokers. So there's clear evidence there over many, many years from the research, and as I've said, I've added the research to the notes page. It's the nicotine that is protecting the dopamine in the brain, and what is also interesting is that Oxford University Parkinson's Disease Centre is doing some research and has done some research, and they've said that they found that nicotine receptors control dopamine release in Parkinson's brain, but in a different way to non-Parkinson's brain. So I think there is a lot of evidence there, and that's probably the most significant therapeutic area of the law. The next area I'm going to refer to, next slide, please, is mild cognitive impairment. Now, has indicated that this is one of the fastest growing areas of decline, and the number of cases are expected to be 130 million by 2050, so it's going up. Now, mild cognitive impairment is often thought to be just normal aging, but it isn't. It's memory loss, it's slowness, it's all of the things which people who, if you see somebody every day, you may not notice them, but they gradually are reducing. And Paul Newhouse's mind study at Vanderbilt University, which I think now is in its 3rd year, he's looking specifically at the benefits of nicotine to prevent and slow the onset of Alzheimer's and dementia. And he is indicating that, you know, in a presentation last year, that he's certainly able to show that. In another study that was done, 74 adults diagnosed with mild cognitive impairment were prescribed nicotine or placebo patches for 6 months. And those using the nicotine patch had an improvement in attention and memory and no serious side effects. And I think that's the thing. There's no serious side effects at all in these areas. Next slide, please, is Alzheimer's and dementia, as I have mentioned. This is just explaining a little bit more how it works. Allegedly, the hypothesis is that acetylcholine transmission is modulated, and it therefore helps to give some value in treating deficits in attention and information processing for those with early onset Alzheimer's disease. Next slide, please. Relates to weight control. Now, this is one area I think is really interesting, and I would say it has definitely worked for quite a number of women that I know. It suppresses the appetite. It provides more metabolism boosting in a natural way. I find also personally, I've used it for 3 to 4 years now, and I don't find any addiction. If I see the can, then I'll get one out, but I don't always use it. There's no sort of desire instantly like there is for smokers, and I think that's an area of research that really needs to be looked at. And this leads on to, especially with postmenopausal women who are smokers, and if we can go to the next slide, please. And that is that women tend to not want to quit smoking because of the huge weight gain. Women gain, or men as well, but, you know, on average 4 to 5 kilos when quitting smoking. So using other nicotine to reduce the amount of weight, or it doesn't reduce weight, it just increases metabolism, etc. But there is indications that over a year of using nicotine without smoke can actually equal a reduction in calories taken, and therefore weight gain. And also, when I spoke to Professor Newhouse, who was doing that mind study that I mentioned, he said that a byproduct of what they found in that study is a lot of, especially postmenopausal women, losing weight as well. And that was not what they're specifically studying. Next slide, please, is psychiatric disorders. Nicotine is very useful for schizophrenia, bipolar, major depression, ADHD, and all of those areas, because it is looking at the cognitive enhancing effects on cognition. And I think that's why when we look at schizophrenia, very high populations of schizophrenic patients use nicotine. They self-select. And the possible reason is that the nicotine is actually attenuating the issues that they're having in the network deficiencies that they're having with cognition. So I know Professor Pelosa and others have done lots of research there, but once again, most of the research is done in terms of smokers. Let's look at areas that nicotine not necessarily coming from smoke is. Next slide, please. Anxiety and depression. I think that post-traumatic stress disorder and obsessive compulsive disorder are significantly enhanced by the use of nicotine. And late life depression, which is very significant, it doesn't have at this time any specific treatment that is used, but using transdermal nicotine for the treatment of mood and cognitive symptoms in non-smokers with late life depression showed a robust response of 86.7% and remission rate of 53%. 0.3% in terms of the benefit of anxiety and depression. And there's information on the slide there that some of these things will indicate improvement in cognition as early as 3 weeks in terms of using nicotine directly for that. And also some studies have shown that e-cigarettes is not associated with the escalation of depression symptoms. And that is also something that is often levied at e-cigarettes, but it is completely, according to the research, not true at all. Next slide, please. Just drilling down into one of those ADHD, attention deficit hyperactive disorder, which many people, and also the other symptoms or other conditions such as dyslexia and other things. Like, I gave my own son at 13 nicotine chewing gum to use in his exams because he had dyslexia and mild ADHD, and he would hyperventilate when he heard people turning their pages before him in exam. I tried it out, it worked, and he has gone on, he's 24 now, doesn't smoke, does use nicotine, but I think we can look at some of the areas that ADHD has a high in youth. That's where many smokers in the youth category are ADHD or have ADHD as well. Next slide, please. This is one I find particularly interesting, is Tourette's. And I found when I was reading the research papers that it can happen in a number of days, some significant therapeutic benefits for Tourette's, those suffering Tourette's symptoms. And that's mostly, once again, done with transdermal nicotine. And it's saying that it can serve as an adjunct to neuroleptic therapy, that is the current method of use for Tourette's. Next slide, please. Relates to digestive and disorders and ulcerative colitis. And there's quite a lot of evidence here showing that transdermal nicotine administered in combination with mesalazine, which is the traditional treatment for it, is actually showing much better results. And also it seems to be exerting a longer lasting therapeutic effect than prednisone, which is also currently used. So once again, big areas for research where nicotine can be very useful. And next slide, please. Ulcers, mouth ulcers. Now, people often say that if you're using nicotine pouches, etc., you're going to have oral issues, and this is just not true. I've not had any for my own use of nicotine pouches. And some of the information in here that you can see is that Nicorette tablets with people who were using it, who were non-smoking patients, it's had beneficial effects on those ulcers and even eliminating them altogether. So it does have some potential benefit there. Next slide, please. Another one that I found interesting is the nicotine improving auditory performance for hearing. The much more clinical evidence is required, but of the studies that I've read and I've pasted in the notes pages, it looks like it's having a very significant effect on difficult listening situations. And just the next slide just has some of the list of some of the areas that I found particularly interesting where nicotine can be useful. I do have at the very end of the presentation a link to some, it's called a Nicotine Therapeutic Benefit Wiki, which includes all of the papers and looking at A to Z of all of the issues where nicotine can have therapeutic benefit. And it's up to people to read through those papers. Many of the papers were done around the late 80s, 90s, but increasingly I've just seen quite a few in the last 3 to 5 years, which are once again showing some very significant benefits in all of these areas. And then lastly, I think turning to my last slide here, I think what is really, can I have my last slide, please? Which is really about what needs to happen. And I think in the next 10 to 15 years, nicotine could be as mainstream as coffee. And that's why I've put the picture of the coffee. But it can be. It's hard to see why not, with so many benefits and so many emerging areas of benefit. But certain things have to happen for it to become more mainstream. And more research is needed, as I've alluded to as I've gone through the presentation. And it needs to be, I think, unlinked from smoking. As I've said earlier, in our community of tobacco harm reduction, we're always talking about getting smokers to cease, and that is vitally important and a number one focus. But there are these emerging areas, and it can be looked at. Nicotine has benefits for non-smokers. And we also need to ensure that there are good regulatory pathways, and indeed the direction of travel with cannabinoids and the acceptance and what's happening there. And that's showing us what could be possible with nicotine if we pointed the direction more at that. And I think what I'd say is, as we all know, the big elephant in the room is abuse liability, addiction and dependence. But on that, I'd say we should not discount the therapeutic benefits of nicotine because of its addictive qualities. And as I said earlier, I don't find that it is addictive. Perhaps it isn't for people who are using it in a different way and have never smoked. I don't know, but certainly that is my own personal evidence. And lots of other women who I've talked to who have been using nicotine pouches as well. And I think, we all know that all drugs have counter indications, and we see them on pack inserts when we get pharmaceuticals, whether it is, an aspirin, high blood pressure medication, lithium, whatever it is, there's always going to be side effects. But I think very strongly that the benefits outweigh any counter indications in terms of using nicotine, and nicotine should be used, accepted, and embraced going forward. So I hope it's a quick gallop through there, but you can have the slides, and please do look at the Nicotine Wiki and all of the PubMed and all the scientific papers from all over the world that support just a few of the things that I've mentioned in this short presentation. So I hand back to you, Konstantinos, and I hope that that gives some people some food for thought going forward.